So today we're in the Hanson Family Dentistry office, and we have Dr. Douglas Hanson, who's going to take us on a tour of his practice. Hi Doug, welcome.
Hi.
Welcome to Valley East today, and thank you for taking us on this tour. First of all, give us an idea of a bit of your background, because I know your background, and you're born and raised in the Valley.
Yes, absolutely. My parents moved to the Valley in 1969. I was a young child and spent my entire life through high school, through undergraduate university at Laurentian, moved to Toronto for my dental training, and subsequently came back and set up my practice in 1992, and have continued to serve the Valley since then, and proudly so.
Yeah, we first crossed paths at St. Anne's School. I was teaching there, and your mom taught there too. So, show us this this place.
I mean, welcome to the practice, and as you can see, the reception area is a little bit different than most dental medical type reception areas. I wanted to not deny the fact that many people are nervous and a little uncomfortable when they come to the dentist or a new office. This concept was to try and create more of a calming living room style reception area for the patients, clients to wait. We've incorporated more living room style furniture. It's a little more comfortable than the traditional style, warm colors, and included features like a fireplace and a television. We offer Wi-Fi for our guests to utilize their various devices, iPads, etc. It's worked out very well. It's a concept that has been well received.
I know I've been in here a couple of times when my wife has been here, and really, you almost don't get enough time to spend in here. You would think that a nice, comfortable place like this, you'd be expecting to be here for a long time, but I also found that patients really move through here pretty rapidly.
Yeah, generally, I think with one of the times that it's really nice is when somebody accompanies another patient or family member on a visit and is not actually here for the treatment, but more for support, and they end up in this area longer than most of the patients are. And it's nice for them to be comfortable and be able to enjoy the facility in that respect.
Yeah, I noticed a room here just for the kids.
Yes, and that was something that early on in my career found that.
Take us in and show us.
Yeah, for sure. We kept it kind of simple. Early on, the concept was children need to burn off energy a little bit, and I think as a former teacher, you could attest to that. But having even just a simple slide, something where they're kind of closed away from the rest of the patients that are waiting, allowed them to kind of run around, and much to the dismay of some of my business team members, make some noise. But by the time they come in for their treatment appointment, they're actually ready, and they've kind of used up their energy in a productive way versus a non-productive way, I guess you could say.
Well, you also have a lot of parents coming in here with more than one child.
For sure, yes. Sometimes it's a sibling or two that gets to keep occupied.
Nice.
So very well.
Yeah. And this is the reception?
Yeah, this is where the receptionists or business team members would do the majority of their work. Try to keep it open, try to create a welcoming environment versus everybody has the picture perhaps in their minds of the older style dental office or medical office where there's a little sliding glass, and basically you slide that closed and sort of separate the the interaction almost in a cold fashion. And I really wanted to create an idea where people can feel like they're actually being served versus shut off from the service. So that was the idea.
Is a lot of this design yours, or have you just picked this up over the years?
I've done a lot of reading and just, I think, common sense, but definitely this latest design, tweaks that were made that I've described were mine. The initial design and the flow of the office was done by a professional designer to lay out, where the operatories or treatment rooms are and so on. I completed a renovation a few years ago, which included changing most of this area to this concept, or these concepts.
I noticed even the washroom is kind of located over to the side, so there's a little bit of privacy. And
Yes, that was again, I think, something that the initial designer had come up with, which worked out very well, and I didn't change it. The washroom for the clients, patients, and family members, wheelchair accessible, which of course is necessary and important in this area. And we offer, a small wheelchair for those who, are maybe physically drained after a long appointment, perhaps to help them out. Some of the elderly population, really appreciates that. It works out well. We have a very nice team lounge for where our team members, staff members can recharge. Sometimes they need to go back there to recharge themselves after challenging interactions with.
You have a fairly large staff too, don't you?
Yes, there's 13 of us and myself. I have 4 full-time dental hygienists, one of which is a restorative dental hygienist, so she can actually complete many procedures, fillings and so on. And the other 3 are traditional registered dental hygienists. And I have 4 dental assistants and 3 or 4 business team members. So I guess 13 including myself.
Wow.
And I also have we have a new dentist that's joined us as an associate, Dr. Melissa Bahel, and she started practice in January, so she's also joined our team.
Great. So let's start working down the hall here and see the rest of this place.
So part of, as we move down this way, you'll kind of notice that there's a bit of a barrier wall, feature wall, I guess you would call it, a bit of an artistic area that separates the clinical end of things where treatment happens from the more business end of things and the more relaxing environment of the reception area that we've described. And that was done to kind of shield but leave things open.
Really decorates
Separate.
things too.
Yeah, it's 2 separate areas. One of the other features that brings me to work with a smile on my face is the amount of light that we have in here. The natural light, skylights and windows in every room just creates an environment that really is a pleasure to come to, even though some people may think it's work, but it makes it very, very enjoyable.
Well, you've been in the practice for a while, and you know that it's not the favorite place for a lot of people to go.
There's no doubt, yes. I mean, that's been the goal, is to try and make it as good as it can get. And I think that when we do make changes to our design and to our flow or treatment delivery methods, that's really our primary goal.
I guess. Okay, we're going to take a look at the rest of the administrative area, and then you're going to take us through to some of the equipment in a couple of minutes. Okay, let's take a look at the record room. I understand that there's some changes taking place with records in medical offices now.
For sure. Actually, you can come on in this way. And this area, when I first started practice in this facility, was all about records. Paper records, closed off from the flow of the patients. It used to house 2 more sliding cabinets as well as a couple of other fixed ones, and it's gotten smaller, and that's actually a great thing. The reason is that we've gone to a completely digital record, and that transition has occurred or started in 2010, in the fall of 2010, I believe, or 2009 actually, sorry, time flies. And as we've transitioned to a completely digital record, of course the paper records start to be phased out. The digital record is completely secure, it's backed up, encrypted. It includes every correspondence we have. In other words, we scan even the paper correspondence, and and emails into the patient chart, so we have no need anymore for any sort of paper record. The
And you can-
advantage for us has been complete freedom of time. We, as a team, spent endless hours looking for lost records, lost x-rays. Any dentist, any doctor would tell you that that's just a reality of practice when you have a paper record, and it's such a a weight off your back to know that you can find everybody's record all the time.
And fast.
And quick, yes. The downside, like all of our lives, is when our technology goes down or we have a power outage, well, we're out of business for that time period. Backups are complete. There's not a risk in that respect. In fact, our licensing body mandates very specific protocols to have things really backed up and organized and private.
And it looks as if most practices are going this way.
I believe so. I mean,
Easier to
the
transfer files too,
for
isn't it?
sure. Yeah, advent of digital radiography, digital X-ray, is probably the first part that really made it easy to transition. So.
Good.
If we move this way, just the last of our administrative area is a consultation room, which is kind of like a private office. It's a closed door room where more complicated treatment plans and treatment discussions can take place. It allows for patients to bring in a loved one that may also be part of the treatment decisions, particularly when things get outside of dental insurance benefits. Decisions have to be made from a financial perspective that can be quite significant. So it just allows a very comfortable environment to make those decisions.
And I imagine a lot of elderly patients don't really understand what they're getting into, and at least they can bring along a son or a daughter to
That's
have everything explained.
for sure. That's common, and certainly any teenagers, children. Most of the time, parents have to be involved, and quite frankly, spouses, for the most part, like to have some input from their spouse, and that in a lot of cases, particularly when it's, like I said, complicated treatment.
Yeah, it's not always fillings and pulling
No.
teeth. There's an awful lot to dental
Yeah,
work
and
now.
even in some of the simpler things, sometimes you're very overwhelmed. I think as a patient, you can become overwhelmed with what was explained in an operatory, in the presence of a doctor, in the presence of a dentist, in the presence of a medical professional that sometimes is intimidating, and you don't always hear all of the details that are important. So it is nice to have this opportunity to revisit some of those details and to be able to listen and take some time to digest these things.
Great. So where to next?
So if we move into this area, we'll go through some of the equipment and technology that we have in the practice. This first area is this is called a Panorex X-ray. It's actually a digital X-ray machine that generates a complete view of the face and jaw components, all the teeth, the jaw joints. It also allows for some three-dimensional imaging to treatment plan implants and things like that, where anatomical structures become exceedingly important to keep in mind, obviously.
Is this a common piece of technology?
It's becoming more common. Most offices would have some sort of a Panorex machine, traditionally not a digital one, and traditionally not with some three-dimensional capabilities. The technology has continued to evolve to go to the next level, and that's the next area of upgrade for our offices, to get into the next generation of three-dimensional imaging.
Great.
The operatories, or the treatment rooms, are on the periphery of this section. We will go into one or two of them just to get a sense of what they look like in the comfort. This would be a typical hygiene treatment operatory, where it's a little more open, and clients, patients would come in for their hygiene visit with whether it's a new patient or their gum treatment, etc. So this would be kind of a traditional one.
I noticed that you got connecting rooms.
It works well in a hygiene setting. So oftentimes one parent might bring two children in at the same time, and one of the advantages to having multiple hygienists is being able to serve an entire family in at one time, so people come at whatever time it is, 3 or 4 p.m., whenever they're convenient, and might bring 2 or 3 children and be able to get all 3 of them serviced virtually at the same time and sort of be in and out of here in an hour. So
What a neat thought.
yeah,
It's-
it's worked out well. One of the other nice features that we included a few years ago from technology is the overhead video screens, which you'll see in every operatory. These actually they serve really 4 functions, but probably the best, most used function is the actual television. So they can play digital media, they can show the digital x-rays or any of the pictures that we take of the patient, and they can follow along in an exam process with cameras and so on. But really, when we play cable television, especially for children, so whatever it is, Toon Network or so on, they basically are in their own zone, and it really makes their appointments go well.
Wow. So the old radio or tape playing is
Yeah,
being replaced by the digital.
for sure. I mean,
That's really neat.
When I started, CD players, Walkmans,
Yeah.
those kind of things. But this has worked out very well.
Very nice.
And it's very convenient. So we'll move. That's a good example of the hygiene rooms. We have a few others. We'll move into the central area here, which is our sterilization area. And the concept here was to keep it wide open, not to worry about contaminating anybody, but actually to show the flow and really feature it such that patients are comfortable with the processes that we put the instruments through. Everything from our sterilizers bank, our sort of area here where things are lubricated prior to sterilization. So the way this works is the dirty side is on this side. In other words, instruments come in from the treatment areas. They're either washed in an ultrasonic cleaner or this dishwasher, which is like a medical style dishwasher. Everything is enclosed in cassettes so that my team members are not, the potential injury for them is minimized. They're rinsed, and this is the wrapping lubrication station where certain things are lubricated, and then they're sterilized. And then when they get to this side, this is the bank of sterile instruments that are then available to be taken out into the treatment areas.
What's nice about this is it's just so transparent. There's nothing hidden.
Yeah, it's the idea. I mean, sure, there's a little bit of clutter. That's the sign of a busy practice. On this side, we used to have a dark room here many years ago when we weren't digital X-ray. In other words, we had to develop our films, and we've used this as a storage area for supplies for the rooms, gloves, things like that. So this is our central storage area, and you'll see a couple of other things. This is a spore testing device, which I point that out only because the newest sterilization guidelines in Ontario for dentistry, we actually have to test our sterilizer function every single day.
Wow. So you want to go over that spore section again?
Sure. So a few years ago, the licensing body for dentistry, or the Royal College of Dental Surgeons of Ontario, published guidelines that we are supposed to follow and have to follow certain things. And one of the reassuring items for Ontarians is that dental office is mandated to do a daily spore test, and that actually not only shows that the sterilizer is functioning, which is indicated by this tape. This is an indicator tape that shows that the sterilization cycle went through. It's white when it's wrapped and it's dirty. Once it goes through the machine, it turns black. But that just tells you that the cycle went. It doesn't tell you that it's sterile. So the spore test tells you that the sterilizer is actually sterilizing, so it kills the spores.
Is this a random test or do you have to do it for everything?
Do it every day, and with equipment that is used for implants, we actually have to put one in every cassette. So every time that particular implant equipment goes through, it has one inside as well.
Wow, great.
And of course, I'm not the expert in this area. I rely on my team, but I'm very confident, and I know that they follow through the guidelines because we have to. So,
Oh, yeah.
yeah. So if we move this way, we'll enter the hallway again. In the hallway, this is a central scheduling station. This allows us to kind of communicate and perhaps book appointments on the way out if there is a bit of a backlog at the business team. So business team member area, the receptionist area. So that's why this is here. And I'll move into this operatory. This is my feature or main treatment operatory for more complicated dentistry. It's a little larger, as you can see, as compared to the hygiene operatories. And that's, primarily because there's always a dental assistant with me, or two, and we have a number of other technological items in here that I'll briefly go through. So the one of the items that I can't live without is the wand, which is a different delivery system for local anesthetic. Instead of the traditional syringe or needle, we use this piece of equipment to freeze patients, and the comfort level is quite good. And the main reason is it's extremely slow. Most of the discomfort associated with an injection is from the distension or the stretching of the tissues as the fluid goes in. So the faster you go, the more it burns, the more uncomfortable it is. This prevents you from going fast because it's controlled. And it works marvelously.
Must be a lot of patients that love that too, though.
They do, and children don't, worry about it because it doesn't look scary. These are the disposable hand pieces that go on it. It's it's a tubing mechanism, and I'm basically approaching you with this, which looks like a ballpoint pen, versus a shiny silver syringe that's a lot scarier than that. So that's that. In this area, in most of the rooms, I pointed to cameras. These are digital intraoral cameras that can take a picture of any tooth, any surface in the mouth, and display it on the screen. It's very, very useful for patients to feel better about seeing what's going on in their mouths, and it allows them to make great treatment decisions and really buy into that they have a crack or that they have a cavity or whatever.
So people can actually watch what you're doing?
A lot of people do like to watch it, yes. There are definitely a portion of the population that doesn't want to see anything. They don't even like me to have this screen. They make me flip it up because they don't want to see their own reflection. So, there's a variety, and of course we're willing to do whatever it takes to make people happy.
Yep.
So, this is my latest technology addition to our practice, and I'm quite excited about this. It's actually it's a scanner, which means that rather large camera takes a picture of surfaces in the mouth. In other words, all of the teeth, some of the teeth, and digitizes it such that you don't have to take traditional goopy impressions anymore. It allows us to do Invisalign. In other words, move teeth. It allows us to do every crown and bridge and implant procedure without actually using a rubber impression material. And the accuracy is phenomenal. So it eliminates small discrepancies that are inherent in regular dentistry, where you take a mold, it's a rubber material of some sort, there's a small bit of distortion. You pour a stone or a dental plaster in there to make a model, and there's a small bit of error, and then you make a crown or a bridge or whatever on top of that, and there's another small little error. In the end, materials and techniques have been perfected to the point that the errors that are added up are certainly workable, but this just eliminates that. I've been using it only for a short time, a few months, and I can say that it is amazing. It's the pictures are emailed directly to the lab. For instance, I believe on Wednesday or Tuesday of this week, we worked on a case, and within 10 minutes, the lab technician in Toronto that I work with was calling me and asking me a question about the case. He already had the model generated. It's generated from like a 3D plastic printer, basically, or a milling machine, which we've most of us have heard about in this day and age, and he can get going on the procedure or on the actual end product. So it's pretty phenomenal.
It's amazing.
Yeah. This is the chair side version of that. So for the last 8 or 9 years, I've been utilizing CEREC technology in situations where it's applicable. It works for single teeth. So if you need a crown, or you have a filling that's so large that you need a porcelain inlay or an onlay, which is like a porcelain filling, we do a very similar method. We prepare the tooth, remove decay, whatever has to be done. We can take a picture of that with this camera, it's a little bit smaller, and design the crown or the onlay with that particular machine. And when we're ready and satisfied that it's going to work, we actually send it wirelessly to this milling machine, which takes a solid block of porcelain of particular color, shade that matches your tooth, and within 15 or 20 minutes it actually grinds or mills a crown or tooth from that particular block. I probably have some examples here somewhere of what one would look like, but maybe not. But this is what's left of that particular porcelain block. As you can see, it was, you know, a larger block like that, and these two diamond mills have ground, customized a crown or an inlay or an onlay or a restoration out of that. So, and this technology has been around for about a little over 20 years, and I've had it in my practice for about I think it's 9 years now, and it's really remarkable. So, and the convenience for patients is that they don't have to come back for a second visit. So most times with crowns and inlays, you would have to return, be numb again perhaps, and you know, and have the inconvenience of having to come back. So it works really well. And again, it has those advantages of eliminating the errors. This is a diode laser. It's an older laser in that it's about 10 years old. It's used for soft tissue procedures, which means eliminating small lesions, taking biopsies, things like that that are sometimes necessary, or you know, if we have to aesthetically contour gum tissue, where, like in particularly this picture that's on the wall, you might see that a couple teeth look a little short. The laser can actually very accurately just kind of almost melt away that gum tissue to make the teeth look exactly the same. So it's pretty neat.
That's amazing.
That's what.
So where are we going next?
All right, so we'll move back down along this area. The other rooms that are here are also dental treatment rooms, very similar to that one, slightly smaller. I did forget to point out that these rooms are more closed off. They do have doors. So unlike the open hygiene rooms that you pointed out, you know, for privacy, we can close things off, and it keeps, you know, keeps people more comfortable.
Good.
So we'll move down this hallway. Again, treatment rooms, they're all very, very similar to each other and have similar technology. Some of the larger technological items, of course, are portable. Those carts that we saw in there, so those scanners can be used in these different rooms as well. Do smooth them. If we move into here, we do offer conscious sedation, which is, you know, nitrous oxide and oxygen. So this is our sort of dispensing area, and another storage area where some of our dental materials need to be stored in cold in a fridge, and it's also where our emergency items are. So our emergency kit, our drugs that we may have to use in an emergency situation, our defibrillator, which, you know, we've had in our practice for a long time.
Don't have to use that too often, I hope.
Unfortunately, we have not. We use it every time we do our CPR recertification and training. That's when we take it out and go through the process to make sure that we still know how to use it. But we haven't had to. But it's peace of mind knowing that it's there, and if we ever have to use it, I hope it saves somebody's lives. Mm-hmm. So that's pretty much it for the clinical area. And unless you have other questions, the only other area, I guess, would be our lab, which is an area where we might prepare some models or mouth guards. We do a fair number of sports guards for hockey teams and so on. So that's just over this way, and then I
Is-
have a private office in the back.
Is your lab open?
The lab is open. Yeah.
Sure. We've seen everything else.
Sure.
It's quite extensive.
Yeah, we've it's a large space and we've got a lot going on. So this is a lab area. It's a relatively simple lab, which means that we don't have a lot of equipment, but we do have the equipment necessary to do our sports guards and so on. So
That's big now, the sports cards, I
sports
guess?
guards are very big. I mean, we make them big as well because we tend to offer them in the last 3 or 4 years at a very nominal cost. $10 donation is what we call it, and we've traditionally been donating the proceeds to one of the recently it's been the Valley East Renegades, which sponsor a lot of minor sport, and it's allowed them to use those proceeds have, I believe, purchased the Hustler of the Game awards for their March tournament they have.
Right.
So it's really a good thing, and the reason beyond doing it for that nominal fee that we do it is it allows people to have custom fit mouth guards, which I believe are extremely important. So we do them, and I think we've on average generated around $1,500, between $1,200 and $1,500. So if we do the math, some people do donate more than $10 because they know it's going to a great cause, but
At least you know they're protected. I guess you have to explain to people that it doesn't mean they're not going to get concussions just because they're protecting their teeth, Phil.
Absolutely, and I mean, but a custom fit one is going to prevent it much more. So,
Yeah.
So that's really what we do here. Primarily, we also have our cases that come in our return from the labs, that are then ready to be inserted. So this is the traditional goopy impression that I was talking about. So I actually took one of these as a backup for that particular case, but then I also took the pictures, and that's this is, in his case, he didn't get the advantage of not having this experience, but we will be moving away from that. So.
Great. And then you just have your...
And then this is a private office area. Excuse the little disarray. I was in the process of installing some equipment. This is pretty much my area where I can recharge and get ready to do dentistry again.
Great.
Okay.
So I guess this will be home for a while.
Yeah,
You-
it's intended to be so. Yes.
You pretty much have everything personalized to
Oh, for sure.
fit your style and your philosophy, and
Yeah, absolutely. I've focused on the basic delivery of care. My additional passion in dentistry has been aesthetic dentistry or cosmetic dentistry, which a lot of dentists say, but we actually do a lot of smile enhancements and reconstructions and things like that. So it's an area that we've really enjoyed adding to our practice. It's not something that I would be able to do every day, and it's not a function of it not being available in terms of the population or work. It's a very challenging aspect to dentistry as much as it's very rewarding. So I still wouldn't be willing to give up the routine interaction with patients for their preventive dentistry and basic care in trade for that. I like it as a supplement. And we've done a fair bit of Invisalign as well, which for those that might be interested in straightening their teeth, it's a wonderful way to go about doing that if their case fits the parameters of what would be indicated for Invisalign correction.
great. Thank you for the tour. You have a website too.
Absolutely, hansondentistry.ca, and I believe it is linked to the Valley East website as well.
Yeah, it'll be right under this video too. So.
That's great.
Yes, thank you. It's excellent.
You're welcome. Thank you for
I
coming.
think we've covered everything.
Good, thanks.